good morning, and thanks Broward Health for hosting us here today. It's great to be back. Joined with the Surgeon General of Florida, Dr. Joe Ladapo. We also have Kevin Guthrie, our Division of Emergency Management Head, Secretary Simone Marsteller for the Agency of Healthcare Administration. Of course, we have the CEO here, Shane Strum. We also have Dr. Joshua Lenchis, who's the Regional Chief Medical Officer for Broward Health. We have Representatives Lamarca, Fabricio, and Barrero. Mayor Mike Udine from Broward County. I want to thank him for being here as well. Last week, I think many of you know, we were concerned about what was happening with taking back of the supply, even more so than has been, of monoclonal antibodies. The federal government had stopped sending both Regeneron and the Eli Lilly monoclonal, and that was based off some preliminary studies saying that it may not be as effective against Omicron, but of course Omicron's not the only variant that's out there, and it's something that we actually have seen applied with Omicron patients, and we have seen symptoms resolved. So it's not clear that this is not something that is going to not be a benefit. It may not be as good as it was against Delta, but we obviously want to have that here for patients to be able to do it. And so we, under Dr. Ladapo's leadership, we push back against that. We feel there's no need for it to just be sitting on the shelves. We asked them to stop preventing the distribution of these treatments. And fortunately, yesterday, HHS decided to reverse course, and they are going to be sending these treatments. I think that's the right thing to do. And we're past the point now where we're able to get it directly from any of these companies. The federal government has cornered the entire market. They basically took control of the supply in September. We had done a deal with GlaxoSmithKline on the Sotrovimab, which a lot of people think is the most effective against Omicron, and that is no longer a possibility because the feds have an exclusive arrangement. So we have been able to see, though, enough data, both from South Africa, Europe, and now here in the United States, to know, fortunately, that Omicron is far less pathogenic than the Delta variant was. It's characterized more as mild and brief symptoms in the upper respiratory region, and an absence generally of pulmonary symptoms, which really was what made Delta so devastating. But we also know that Omicron spreads far, far more rapidly. I think if you look around the world, any place that has had Omicron in significant numbers, you don't really have a slope. You have like a straight line going up in terms of how quickly it spreads. And I think we've also seen with Omicron, the vaccinations are not preventing infection. Miami-Dade, for example, is one of the most vaccinated places in the country, if not the world, and they've had huge Omicron infections. And so that's just the reality in terms of that this thing is spread very, very rapidly. There's indications and some studies out of South Africa that an Omicron infection may generate immunity against the Delta variant. And that's important because, yes, in Florida, particularly South Florida, we do believe it's overwhelmingly Omicron infections that are occurring, but Delta is still there, and most of the people that get really seriously ill are still being infected with the Delta variant. And so it's important to understand that and be able to have a strategy in place that is going to deal with both of those. And so we're able to be able to say today, now that we've gotten the pathway cleared with the Regeneron, now that we've gotten the pathway cleared with the Bamlanivimab, and of course we want more and more of the Sotrovimab to do, we have the ability, and we will immediately turn on additional sites as soon as the federal government gives us a supply. We will do an additional site here in Broward County. We'll do an additional site in Miami-Dade. We'll do an additional site in Palm Beach County. We'll do an additional site in Central Florida. And we also have the capacity to increase of the existing footprint, which we do have a good existing footprint. And we have the ability to add 5 to 10 more sites as the demand may be. But that is all contingent on the federal government sending the doses that we need. And so we're looking at probably between 30 and 40,000 additional doses. This will be used very easily. We've got the infrastructure in place. After we did our sites over the summer, Once the demand declined, we were able to effectively mobilize them within each community. So there's some places where the hospitals take the lead. There's others where sites are run, and it's a variety, but people have had access on that. But we also knew that if there were increases in the future, we wanted to make sure that we had the capacity to be able to ramp up very quickly. And so those sites will be up the next day. They're ready. We have DEM, we have health. It's all locked and loaded. It's just a matter of federal government giving us more doses to be able to administer for the Floridians who need it. So that will make a positive difference. And we also had the foresight to ask the legislature in October to set aside money so that we would be able to handle this and there'd be no issue with it, including purchasing our own supply. I don't think we have the option to do that in terms of the federal government's exclusive arrangement, but if they were willing to sell it, we have the ability to buy it ourselves. So that's close to $1 billion that's been set aside to mobilize to be able to treat people, and we're glad that we were able to do that. We also are looking, if you look at the Jackson down in Miami, the biggest system down in our biggest county, they have been putting out data distinguishing the people that are COVID positive in the hospital for something else and the people that are actually being treated for COVID. I think that's an important distinction to make when you have a variant like Omicron, which is much more widespread. You are going to have people who get into a car accident and go into the emergency room. They're swabbing everybody, and you're going to have people that have incidental positives. And so they've anticipated about half of their COVID positive patients within their system are not being treated for COVID. And I think you're likely to see bigger percentages in that regard than we've seen throughout the pandemic. And so that's important when you look, right now in Florida, we've seen increases, but we still have, I think our ICU COVID utilization is the lowest per capita in the country. Right now it has gone up like everything has since November, but looking to see who is being admitted for COVID versus who may be admitted with COVID is going to be important to really chart the severity of what we're seeing. And we do think the most severe cases are still the Delta variant. In terms of, we were talking with the mayor about there's obviously a crunch on the availability of tests. We were promised a lot of these home tests. That's the federal government has total control over that. They've promised hundreds of millions of tests. I don't know when that's coming, if it'll come. Sending it to people or letting them do that without having to go into a line would probably be the most efficient way to do it. If we had the capacity to buy some, we would have bought some, but we can't. It's all going to be done through the federal government. And so I know that there's been promises made in that regard, and so we will see. We have pushed out from the Department of Emergency Management in the last 6 months over 1,500 requests for tests. We've done 50 in Broward County. Now, because of the limited supply, what's asked for, you got to look to figure out, try to spread it around as best you can, and that's what Kevin has done. So there is a crunch on this, and that's just going to be the reality until we get the federal government to start sending more down. But in the meantime, Dr. Latipo is working on providing some testing guidance about who should be testing. I mean, you want to test in order to get a clinical outcome, and that has got to be readily available for anybody, particularly our vulnerable populations who are infected. But I think what you're seeing is there's people who go to the drugstore, they'll buy all these tests, they'll go multiple times a week and go to the sites and test without symptoms. That is just going to contribute to some of the crunch that you're seeing. So he's going to work on putting out some guidance to try to say, let's test for a reason, and if you need the treatment, obviously we want the treatment to be there for you, and I think that that'll be something that'll be very well received. So we are ready to go on all this and have been ready for a long time. We do not believe that the federal government should be holding back any more medications. We think we have to offer this, particularly for our elderly population. If you look at Omicron and the profile that we're seeing in terms of the clinical outcomes, it's always been true with COVID that the younger folks were less risk, but I think that's even more true with what we're seeing with Omicron. And it's just like other respiratory viruses. You know, elderly people are just going to be more, people that have health problems are going to be more at risk from any type of respiratory infection. I think that's what we're seeing with Omicron. So we really want to focus and make sure, and Simone is going to talk a little bit, you know, if you have an outbreak in a nursing home, we are going to send the teams in there to go with the monoclonals, with whatever we can do to be able to help alleviate that situation. And those are the folks that are going to be most at risk on this. The other thing that we're looking at doing, and it's not, the technology isn't where we would want it to be like it would be for, say, distinguishing between influenza strands, but you can sequence these test results to try to figure out if it's Omicron or if it's Delta. When they do the estimates about South Florida, 90%+ in Miami, you know, they're taking a subset, they're running that through, and then they're extrapolating out to the whole county. So we think it would be something that if you could turn it around quick enough, if you do have a patient who is high risk, but they're not necessarily showing significant symptoms, if you could get it in a decent time, then maybe you know, okay, it's Omicron. Maybe we will focus on the sotrovimab. If it's Delta, well then we'll do the Regeneron or however the practitioners think makes the most sense. But we do not have the technology right now to where you get tested and then you can determine right immediately whether it is Delta or whether it is Omicron. We would need to sequence that. That takes a little more time, a little bit more manpower, but it's something I've asked Dr. Ladapo to look at, bringing together with some of our treatment sites so that we can focus treatments the best way that we can. But we are ready to go. We're ready to receive, and we will put all of this to good use. You can bet your bottom dollar on that. And to expound upon some of the treatments as well as the testing, I have Dr. Ladapo is going to come up and say a few things.
Yep.